Okay, now we're going to talk about two remnants from fetal circulation. If we look into the right atrium, we can see this kind of large brown circle. This is representing the scar called the Fossa Ovalis. Now, during fetal development, this was a shunt called the foramen ovale that shunted blood from the right atrium over to the left atrium, thus bypassing the lungs that were not working anyway at the time. Now, most children are born with a hole in their heart. Now, this is a teeny tiny hole, about the size of an end of a sewing needle, and that is this hole. Now, it'll finish closing over the next month or so with no issues. However, some people have lived their whole life without it closing. But again, it's the size of the end of a sewing needle. Now, the model shows it quite large. That is just to show you where it is and kind of give you a bigger image, but it's not really that large. All right, the next, if we go up here between the pulmonary trunk and the aorta, we see the Ligamentum Arteriosum. Now, again, this is a shunt held over from fetal circulation. And what it did was shunted blood from the pulmonary trunk over to the aorta, thus bypassing the lungs that were not working. Now, toward a couple of months before the child is born, this will fibrose and become a ligament, now called the Ligamentum Arteriosum, and it helps hold the aorta and the pulmonary trunk close together. That's it.